Hello, my name is Ashley. I'm going to be conducting the head to toe examination today. First thing I'm going to do is wash my hands. Okay, after you have washed your hands, I'm going to apply gloves. The first thing you're going to do is identify the patient. So can I have your name and date of birth?
Lisandra Morales, September 8, 1989.
Okay, perfect. Do you have any allergies?
No.
And you're just here for your head to toe examination?
Yes.
Okay, perfect. So the first thing we're going to do is we're going to start by inspecting the patient's head and face. So the patient's face is symmetrical. There are no lesions present, no signs of any abnormalities. The hair is evenly distributed throughout the head. No lesions. Now we're going to go ahead and palpate. And on palpation, you're going to check for any dents, any indentations, any signs of lice. She has no signs of lice, no indentations present, no lesions either in the scalp. Now we're going to see the face for any drooping. There's no drooping in the face. In the eyes, we're going to assess now cranial nerve number 7, which is the facial nerve, and you're going to ask the patient to puff out her cheeks. Puff out her cheeks or smile. Okay, perfect. So cranial nerve number 7 is intact. While we are here, we're going to check for the temporal arteries bilaterally. Okay, so it is at a +4, which is a normal finding. We're going to now assess cranial nerve number 5, which is the trigeminal nerve, and we're going to assess for mastication. You're going to ask the patient to open her mouth against resistance of my hand. Okay, perfect. So cranial nerve number 5 is intact. Now I'm going to palpate the temporal mandibular joint, and you're going to ask the patient to open and close the mouth. And this is to assess for any crepitus or TMJ. On palpation, there was no crepitus noted when she opened her mouth. Do you have any pain when opening and closing your mouth?
No.
Okay, perfect. Okay, so now we're going to palpate the frontal and the maxillary sinuses for any tenderness. So you're going to tell me if you feel any pain.
No.
Okay.
No.
Perfect. Okay, so the next step we're going to assess the patient's eyes. So have you had any issues with vision lately?
No.
Okay, perfect. So on inspection, the patient's eyes are symmetrical. There is no discoloration of the eyelids, no drainage, no erythema present. We're going to assess the patient's sclera. So the sclera is white and the conjunctiva is pink. We are going to now assess for the cranial nerves 3, 4, and 6, the oculomotor, trochlear, and the abducens. And we are going to assess this by checking for the 6 points of the cardinal gaze. So just follow my pen light with only your eyes. Okay, perfect. So we're gonna now assess for accommodation. Follow my pen light only with your eyes as well. Perfect. And now look ahead. Look ahead over there, and I'm going to assess for pupillary constriction. Okay, so the pupils do constrict when the light is shining directly into the eyes. Pupils are 4 millimeters bilaterally, and perla is intact as well. We are going to now assess the patient's ears. On inspection, patient's ears are free of any earwax, no tophi present, no signs of any drainage, no lesions, no erythema. We're going to assess the tympanic membrane. So the tympanic membrane on the right ear, the cone of light is at 5 o'clock. The tympanic membrane is gray and pearly, vibrations noted. And on the left ear, the cone of light is at 7 o'clock. Again, it's pearly and vibration noted. Tympanic membrane is intact. Are you having any difficulties hearing?
No.
Okay, so now we are going to assess cranial nerve number 8, the acoustic nerve. The patient is going to cover one of her ears, and I'm going to whisper something in her ear, and she has to tell me what it is.
Apple.
Okay, cover the other ear.
Pear.
Okay, perfect. So cranial nerve number 6 is intact. We are now going to inspect the patient's nose. So on inspection, the patient's nose, there's no signs of deviation, no signs of septal deviation. We're going to, can you tilt your head back? Looking on the inside, the nares are both patent. No, the turbinates are patent as well. Are you able to breathe fine?
Yes.
Can you occlude one nostril and blow out of your nose? Okay, and the other one? Okay, so both nares are patent. While we are assessing the nose, we are also going to assess cranial nerve number 1, which is the olfactory nerve. We're gonna ask the patient to close her eyes and occlude each nostril and say what she smells. Okay,
Alcohol.
okay, now the other one.
Alcohol.
Okay, perfect. So cranial nerve number 1, the olfactory nerve, is intact. We're going to now assess the patient's mouth. So on inspection, the patient's lips are not cracked. There's no signs of any cyanosis. You're gonna ask the patient to open her mouth and say ah.
Ah.
Okay, so on inspection, there's no signs of any cracked teeth, no cavities present. Say ah.
Ah.
Okay, when you ask the patient to say ah, you're assessing the cranial nerve number 10, the vagus cranial nerve, and you're assessing for uvula movement, which is present. We are going to ask the patient to stick out her tongue and move it side to side. Okay, so cranial nerve number 12, the hypoglossal, is also intact, as well as cranial nerve number 9 is also intact. We are going to now check for the patient's neck. On inspection, the neck is midline with the rest of the body. No lesions present, no discoloration, no abnormal discoloration present. We are going to palpate the trachea as well as the thyroid. So the trachea is midline. Do you have any tenderness?
Mm-mm.
Okay, and the thyroid is not present, which is a normal finding. We are going to now assess for JVD. We're going to lay down the patient at a 45-degree angle. And we're gonna ask the patient to turn her head that way. And we're going to assess for JVD. So there is no JVD present, which is a normal finding. You can sit up. Okay, we are going to now assess for cranial nerve number 11, which is the accessory cranial nerve. I'm gonna ask you to shrug your shoulders up against resistance. Okay, perfect. So cranial nerve number 11 is intact. Now we're going to assess the patient's lymph nodes for any tenderness, starting at the preauricular, the postauricular, the occipital, the parotid, the tonsillar, the submandibular, the submental, the superficial cervical, deep cervical chain, post-cervical, and supraclavicular. Do you have any tenderness?
No.
No lymph nodes were palpated at the time of assessment. The trachea was midline. The thyroid gland was not palpable. We are going to now assess the carotid arteries individually. Pulse is present at +4, which is a normal finding. We're going to now auscultate for any bruits at the site with the bell of the stethoscope. Okay, no bruits noted on auscultation. We are now going to assess the patient's upper extremities. So on inspection, there is no signs of any lesions. There's no abnormalities of the fingers or the joints. No nodes present. We are going to assess for capillary refill. So it was less than 3, which is brisk, which is a normal finding. We're gonna assess each joint for any crepitus. Do you have any pain or
No.
tenderness? Okay. Perfect. Okay, so now we're going to assess arm drift. We're going to ask the patient to reach out her arms, extend her arms, and hold them there for 10 seconds, and note for any arm drift. Okay, perfect. no arm drift noted, which is a normal finding. We're going to now assess the radial pulse bilaterally. Normally, this exam should be performed for 60 seconds or a minute, and normal findings would be 60 to 100 beats per minute. In her case, she was at about 62 beats per minute, which is a normal finding. We're going to now inspect the patient's chest. So the patient's chest is not protruding or barrel chested. The patient is not displaying any signs of respiratory distress. She's not breathing with any of her accessory muscles. Are you having any difficulty breathing?
No.
Okay, perfect. So we are now going to auscultate the heart sounds with the bell of the stethoscope, assessing for S1 and S2. We're gonna start at the aortic, the pulmonic, Erb's point, tricuspid, and the mitral, which is the point of maximum impulse. We're going to conduct the same assessment now with the bell of the stethoscope, noting for any murmurs. Okay, so no murmurs heard, nor abnormalities heard at this time. We are going to now assess the patient's lung sounds. We're going to start right above the clavicle. We're going to assess as well with the diaphragm of the stethoscope. And you're going to ask the patient to breathe in and out. Okay, so no adventitious breath sounds heard at this time. We're going to repeat the same steps on the back posteriorly. Okay. We're gonna check where C7 is. Go right above the scapula. Breathe in and out again. Okay. No adventitious breath sounds auscultated at this time. We're going to now assess the patient's abdomen. Okay, so if you can lay down. So in the abdomen, we're going to inspect, then auscultate, later percuss, and perform palpation. Palpation will be the last step. So on inspection, there is no protrusion of the abdomen. The belly button is inverted rather than everted. We're going to now ask the patient if she's had any difficulties with bowel movements.
No.
Okay, perfect. So now we are going to auscultate, starting at the right lower quadrant. Okay. You're gonna move clockwise. Normal finding would be 5 to 30 bowel sounds heard in the length of 1 minute. Patient's bowel sounds are normal active. We are going to now palpate. We are going to Before we palpate, we are going to auscultate the arteries for any bruits. Right above the umbilicus, the aortic. The iliac. And the femorals. Okay, no bruits noted at this time. We're going to now perform the palpation. You're going to start off with light palpation, noting for any tenderness in all 4 quadrants. And then you're going to go in with deeper palpation. Do you have any pain?
No.
Okay. No hernias noted. Patient describes no tenderness present, which are normal findings. We are going to now assess the patient's lower extremities. Okay. We're going to now assess the patient's lower extremities. Okay, so hair distribution is even on both legs. No signs of any lesions. No edema present. We're gonna also check capillary refill of the toenails as well. Okay, so it is less than 3 seconds, which is brisk, which is a normal finding. No cyanosis present. We're going to also assess the patient's peripheral pulses, starting behind the knee, the popliteal pulse, the posterior tibialis, and the dorsalis pedis right on top of the foot. Okay, so peripheral pulses are all at a +2, which is a normal finding. We're going to assess for muscle strength and ask the patient to pull legs up against resistance. So can you pull up your legs? Okay, perfect. And now we are going to, lastly, we are going to assess the Babinski reflex by running a rigid, sharp-tipped object along the bottom of the patient's foot. And normal finding would be that the toes curl. Okay, so that would indicate a negative Babinski test. So that indicates the patient has no neurological issues or deficits. Okay, I ask the patient to sit up. Do you have any questions for me at this time?
No.
Okay, perfect. So at this time, we have concluded our head to toe assessment. Yeah.